you want to use public transport in our city, the bus, the tube, the tram, the overground, a condition of you using public transport is you must wear a non-medical facial covering. And the advantage of doing so is it stops you spreading the disease if you're asymptomatic or pre-symptomatic and don't realize this. But if other people wear it, it can stop you catching it as well. And all the evidence around the world, from the USA to Canada, from China to South Korea, from Germany to Austria, is doing so can lead to the virus spreading less fast. But this is on top of all the other things we should be doing. Don't leave your home unless you have to. Keep your social distance over at least 2 meters. Wash your hands regularly and thoroughly. And it's really important we do those things. And additionally, wear a non-medical facial covering where we can't keep our social distance.
Were you always of the opinion, Sadiq Khan, that this would have been the right thing to do for health reasons in London? And if you were, why didn't you make it happen sooner?
Well, the evidence was quite clear from late March, early April, and I was speaking to colleagues around the world who were doing this. And I was lobbying the government since more than 2 months ago to do this. My concern about going it alone was it's really important when you've got a crisis, we've got a crisis, that we have message clarity and we have a national consensus. For example, in London, not all the public transport is under my control. And what we didn't want was confusion in relation to those commuters coming in from outside London to London, but also a blurring of the messaging. And so that's why it was important to try and persuade the government to do the right thing. And my concern, and I'll go far as to say my anger, is the delay it's taken, because this could mean more people having caught the virus in the community, because there are some times where you simply can't keep a social distance. And this delay, I think, has been good for nobody.
Everybody is, I mean, you're in an accountable position. What you seem to be saying is that you could have brought this in sooner, albeit I'm not quite clear which part of the public transport system is not within your control. Maybe you could establish that for us, but you could have done something sooner.
Yes, so the commuter trains that come into London aren't under our control. And also there are big concerns in relation to London having a different message to the rest of the country. The government's been keen on, and I support this, having a national response to both going into lockdown and easing lockdown. But also, I'm well aware that many Londoners rely upon national media, like the BBC Breakfast and other forms of media. We don't really have independent media, and so it would have been really confusing for Londoners who may inadvertently have been breaking the rules, been refused use of public transport at a time when they weren't aware of the need to do so. That's why it's important for there to be clarity from the government and no confusion. I'm pleased the government's done this U-turn. So from Monday week, anybody who wants to use public transport across England will have to wear a non-medical facial covering. This isn't, by the way, a visor or a surgical mask. PPE should be reserved for the NHS and care homes. You can make this at home with a scarf, with a bandana, with a snood, with cloth. It's really easy to do so.
Can I talk to you about how this will be enforced and how this works in practice? I turn up to get on the tube and I'm not wearing a face mask, and I tell I don't know who it is who's at the gate, I say, well, I have a breathing condition, so I can't wear a mask. What happens next? Do I have to prove it? Who decides whether, given that information, do you take it on face value? What happens?
Yeah, there'll be an element of discretion and good faith, and so the TfL staff will be applying their discretion. And if you've got a good explanation, you won't be forced to wear it. Similarly, a child won't be forced to wear it below a certain age. And the idea is enough of us wearing this will stop the virus spreading faster. And so nobody wants to penalise people with a health condition and force them to wear it.
OK, but if I may, just in terms of how this works in practice, and anyone who uses, particularly, this is maybe particularly a problem in London, but it will apply elsewhere. If you're on a bus or you're on a train or you're on a tube and 3 people sitting opposite you are not wearing face masks, you might well have a problem with that. I mean, on a practical level, you will, but also you might think, well, hold on a minute. Maybe you'll think, do I need to ask them? How is it they're not allowed to? You see, it could end up in awkward situations I mean, how do you advise people around that?
Absolutely, and that's one of the reasons why it's important to, in a non-patronising way, educate the public why it's important. Secondly, actually, a lot of this will boil down to positive peer pressure. But thirdly, don't take the law into your own hands. Speak to a member of staff who will make sure that it's enforced. What we're doing over the next few days is working with not just the British Transport Police and the National Police Chief Councils, but other transport authorities across England to make sure we have consistency so TfL isn't doing things differently to others. But I've been really impressed by the overwhelming majority of Londoners and those across the country who follow the rules. And I'm confident, actually, by and large, most people follow the rules voluntarily. But if there are examples of people not wearing a facial covering, what will, I suspect, happen is people will politely say, hold on a sec, why aren't you wearing a facial covering? Isn't that a bit selfish? And they can explain why they're not, or pressure is put upon them in a polite, courteous way, and they'll start wearing one.
Just one last thought, if I may, going back to the reasons why you didn't bring in the ruling further, and I've heard your explanation there. There might be people listening to that and thinking there is an uncomfortable truth in this, that delay will have cost lives. Do you think that is the case?
My concern is the delay in this being mandatory may have led to more people catching the virus in the community you may not have done. We've still been keen to make sure there is social distance on public transport, so the maximum capacity that we should have is between 13% and 15%. We've got markings across the tube system now and bus stops as well. On our double-decker buses, only 20 passengers are allowed on for that reason. It's normally 85. On our carriages, we're trying to make sure fewer people use it. And by and large, people have abided by this. We've been asking people, if they've got to use public transport, avoid the rush hours between 5:45 and 8:30 in the morning, between 4 and 5:30 in the evenings. And the reality is, for the foreseeable future, we're discouraging people to use public transport. If they have to,
Sadiq,
please avoid the rush hour. They've got to wear a face covering from Monday week.
Okay, thank you, Sadiq Khan. Thank you very much for your time this morning. That is Sadiq Khan, who, of course, is Mayor of London.
We will make America great again.